So let's get started on our day. Our very first speaker is Dr. Kultar Garcha, who is an MD, and he is the Chief Medical Officer of Flow Neuroscience, which is based out of Sweden. Dr. Garcha, we're glad you're here. Thank you so much for joining us.
Thank you. Thanks, Sherry, and to the NPA for inviting me.
Okay, so our discussion today with you is going to be about Flow Neuroscience's headset, the FL-100, which is a newly FDA-approved treatment that represents really the first of its kind, a medically certified at-home device that uses transcranial direct current stimulation. That's a mouthful for me today. And this is really geared for treating depression at home. I know that it's used in other locations for other purposes, and so you can walk us through that a little bit today. I think you have some slides you want to share up front to get us grounded in what the FL-100 headset is and the neurobiology around how it uses, correct?
Correct. Yes.
Very good. I will turn this over to you then and let you go through those slides, and we'll be joining Dr. Garcha back at the end for some Q&A. So please do drop your questions in the Q&A box. All right, all yours, Dr. Garcha.
Lovely. Thank you. And I really appreciate and love the fact you shared all the reflections of what's been happening. And I 100% agree. We need to always demand and understand what are the other options. A lot of this is sometimes around education. I'm still learning, I'm practicing as a family physician. We can't always keep up with the latest developments, and sometimes it's easy to dismiss them because we haven't researched them. And so we need to all advocate. I'm a patient as much as I'm a doctor as well. We also need to advocate for what is out there and what can help, and really understand the individual. We can look at numbers. I'm going to present some numbers on the slide with the slides as well, but it really comes down to that person at that time when they're interacting with their healthcare provider, what can be done. And I joined Flow partly on the back of my experience actually with some of my patients. I very sadly had one of my patients who died by suicide in 2021 after a long battle with depression, had multiple treatments, but actually had disengaged, hadn't really been coming to see me. And then I learned of the tragic suicide afterwards. And it's clear that's one horrific and extreme example, but just sometimes the treatments don't always work. And there's a big problem. That's one individual, there are many. But depression itself is really a massively prevalent disease. It's the leading cause of disability worldwide, with a massive scale, so over 330 million people who are sadly suffering with it. And that's getting worse. And the problem is, although treatments can be very helpful, and I still prescribe some of them and use them, they don't always work for everybody. The STAR-D trial is still the largest of its kind. That was looking specifically at antidepressants. And less than, or about 28% of individuals achieved remission on their first medication. So it works, but clearly not for the majority. And on top of that, individuals then suffer with a number of side effects: sexual dysfunction, weight gain, emotional blunting. There are several. And sometimes, rightly so in my opinion, those side effects can be so troublesome that the individuals would choose to stop their treatment or not really take it. Talking therapies also can be excellent, is excellent, but it's scarce. Waiting lists can be high. Sometimes insurance doesn't even always cover it, and people are left with this transition. And battled with that and facing that those were the two options and wasn't working for everybody, I really looked out for what else is there. And it was actually a patient who came and presented the Flow device and said, is this something I should consider? And that's when I started to look into it. And that's one individual of many. There are so many. There's right now, last year, we look at over 250,000 individuals who are looking at support groups and sites for those who are just looking at SSRI side effects, withdrawal, tapering, how do you come off them, and so forth. And this is part of a wider story, not just support sites. People are presenting to healthcare providers, family, friends as well. And we're seeing that on the background of this increasing depression issue as well. So Flow is a Class 3 FDA approved device, as you mentioned, Sherry, which can be used at home. It's a prescription only device, but it can be entirely managed and used remotely. And the device itself, and actually I'm holding it up for those that you can see. My turban is in the way, so I can't show you how I use it, but this is the device, this is how it gets shipped and used entirely at home. Now, the device itself, you can turn it on, you can charge it, but it won't work like it is. So there are some safety features that will come onto itself. It's had FDA approval since December last year. It has been available in other regions, so UK, where I practice, and EU for a few years now, and also in Australia and a few other regions as well. So there are slightly different ways and means by which you can get it. For instance, in the UK now, you can actually buy this over the counter. It's been deemed safe enough by all the regulatory bodies that this is something that people who are suffering with depression, that's what it's indicated for, but can buy this themselves and then have supervision from their providers. And just to briefly touch on what's happening, the device itself, so that's TDCS, and yes, the full word is definitely a mouthful, Sherry, but it's sending a 2 milliamp current, and it's sending that to the part of the brain called the dorsolateral prefrontal cortex. Again, we've shortened that to DLPFC, but the take home of that is this is the area of the brain which is responsible for emotional regulation, executive functioning, so memory, learning, how you deal with things. It does touch on pain, we'll come on to that after as well. And it's targeting that. What it's doing is improving or increasing the activity in that part of the brain. So we know that in depression, that area is less active. The brain cells, the neurons in that area aren't firing quite as regularly as we would like to have them firing. So by sending this current, it just nudges these neurons to become a bit more active. It doesn't actually cause them to fire itself. So slightly differently to TMS, TMS causes that firing. You heard about TMS yesterday. TDCS just sends, it's weak enough that it doesn't cause firing, but over time, it makes them more excitable. So those neurons then fire more regularly. And where does it sit in treatment? Now, I've mentioned medications. They are significantly cheaper, and they are the mainstay without and talking therapies. And then on the left of this graph, you can see some of the more novel or sometimes the inpatient treatments as well. So TMS is there. It is also a form of neuromodulation, ECT, and there are newer medications as well, ketamine, psychedelics. We've put Flow here because of its relative affordability and also some of the effectiveness that it has, which I'll touch on in a moment. Now, although this device has just been approved, actually the technology underlying it has had decades of research. And since 2020, it's had the highest level of evidence for the treatment of depression. We did, as part of the FDA approval, a study, the largest of its kind for at-home stimulation, which was published in Nature Medicine. And this was showing for those who had moderate or severe depression to treat with, this shows the remission rates at the end of a 10-week period. And what we find, and there's two treatment outcomes, but the 45%, the two on the right, so the 45% is the Hamilton rating, and then the one on the left, the 58%, is one of the secondary outcomes, the MADRS. And both of those scales are routinely used for measurement of depression severity symptoms. So even at 10 weeks, we're getting very effective results. Now, although there was not a head-to-head study, so we did not do as part of that study a direct comparison of the Flow device versus conventional antidepressants. But when you look at the underlying data for those studies, mentioning the STAR-D trial again, if you look at the odds ratio, so the chance of those working, Flow fares really favorably on those initial results. In addition to those, as part of the study that was done on Nature, a subset of those individuals were also on antidepressants already. So this was trying to be representative of individuals we would see in daily practice. Now, there are exclusion criteria, of course, there needs to be in randomized trials, but in this population, as long as they had been on a stable dose of an antidepressant for at least 6 weeks before starting, and then maintain that dose throughout the course of the study, they were eligible for this. And what it showed was a significant improvement in those functions. So by virtue of the fact that they already still had moderate severe depression, the antidepressant had not worked for them. By adding Flow, who had just under 71%, achieving 50% or more reduction in their severity scores. Now a little bit more into the practical aspects of the device. Each session is half an hour long. And for the first 3 weeks as part of phase 1, we ask users to use that 5 times a week. So you can't do more than one a day, even if you turn it on and it's all controlled by the back-end app. But 5 times a week for 3, and then after that, that goes down to 3. Now there is customization allowed, which physicians are able to do depending on what the response is like, but this is what this protocol follows what was done in the study. And those components I mentioned, so we've got the headset, but that will not work unless you have the app, and the app is what controls everything. It's also got some behavioral therapy modules as well. And then finally, for clinicians, for the prescribers, they can also then see the progress of what's happening, and also then if they need to customize what is happening with the schedule. Quick thing of what the user sees. So when they're using it, it just guides through how to put it on. Each time you put it on, it will go through to make sure the placement is correct. The modules that I mentioned, behavioral therapy content, and then also it shows you how you're doing. Now, one feature of the app and the device is every week you need to complete a survey, a mood survey. So you're able to then, we can show this back to users of how they are progressing with the treatment, of their scores going up or down, and it's something that they can track for their own progress. So last few slides, and I'm sure we'll turn over to questions, and thank you for bearing with me. But just to say that this is, although it's new to the US, it hasn't officially launched. We've had FDA approval, we're working towards that, but we have built up a lot of real world evidence. We already have over 60,000 users, and many physicians and providers who are using this in their own clinics and hospital systems. It does lead to fewer appointments because of the fact this can be used remotely. It does work alongside medications and other treatments. It doesn't have any interactions, and it's highly accepted by users when it's offered as a treatment option. A little bit more on data, and I know this is a very busy graph. This is just representative of our real world. And I think the key thing that I want to share from here is, if we look at the majority of people who started with moderate or severe, that's the orange and the red, and even by week 3, we can start to see how much improvement there is. So their severity, their symptom severity already starting to improve significantly, even at week 3. Now, comparing that to antidepressants, I typically say to patients, if we use them, sometimes it takes 6 to 8 weeks before we start to see the effects we need to consider. So you can start to see results very quickly, and those results aren't short-lived. So with continued use, we can see that there are additional benefits and more people who are getting better. The final thing to say, there's not a graph for it, but also very safe in terms of side effects. So we have less than 4% reported side effects. So if users do experience them, they email them through to us. So still very minimal side effects. The majority are skin related, around where the electrodes sit, and then people describe headaches, but typically again for the first 2 or 3 weeks of use, and that goes down. I want to come back to users, and I've got a couple of case studies I will share as well. I have talked about populations, I've talked about numbers, I've talked about statistics. but this is still the best part of my day when I get to see what effect it has. This is not, I'm not framing this as stop all other treatments and this is replacing them. But this is saying that flow is another option. It's something else that can be used alongside those. And we need to always tailor and see what works best for that individual. I think we need to move away in the spirit of this conference and this summit generally of this is not just always chemical, and neuroplasticity generally is something that we're learning more and more of. There's more research happening, but a lot of the research even to date has been very compelling, very strong, and we need to build on it. The FDA indication is for moderate and severe depression. Now, this touches on what I was just saying. This is not to say it's a replacement. It can be used as a monotherapy. It can be used as an adjunct as well, so you can combine it with other treatments. But it can work across all depression. Although I've only highlighted moderate and severe because of what the FDA indication is, in other regions it can also be used both for mild and for treatment resistant. But so this shows just, again, depending on which market, its usage, but it can be used alongside, and the key difference is how many stimulations a user does, and that can be controlled by the physician. So there is definitely flexibility. It's not just one protocol, but working and individualizing and personalizing treatment alongside other things is what's really here important. A couple of case studies before I close, just to show, and these are examples, a couple of mine and some other of our physicians that work with us, but just showing again the real world applicability. So this unfortunate individual, so this man, 42-year-old, who had recurrent episodes of depression, and sadly depression is one of these things that even when you get better is a high likelihood or higher likelihood that it will come back. So third episode, and wasn't responding to medications, was on venlafaxine, was on another one as well, citalopram, but even then not a very good response. So at the time Flow was started, was severely depressed based on the score. And we can see that that was on 29th of May. By the 13th of June, we've got that individual, he's in remission. From not really improving on medications, we can see the dramatic results in a very short space of time. So 2/3 reduction in his symptom severity. Depression does not exist in isolation. Obviously, many things are comorbid. You can have a lot of physical issues, you can have other mental health conditions as well. We've touched on anxiety, it's going to be talked on later on the day. It can increase pain symptoms, it can have issues with sleep, insomnia and everything else. This individual had ADHD as well. And on top of that, sadly, had a cancer diagnosis as well. Now, antidepressants, and sometimes you don't want to take them alongside both chemotherapy and tamoxifen, and so didn't want to start them. What other options were there? Mild to start with, but again, it's just showing that where medications or where something's unsuitable, or if there's patient choice, again, something can then be used. Conscious of time, so I will just skip through to show sometimes it doesn't always work. So this is not, and this touches on the science as well, it doesn't always work dramatically. You won't always see those nice curves of always showing down because life gets in the way. And sometimes this can be linked with how often you stick to treatment. We hope that when anything is prescribed, that everybody takes them exactly as prescribed. Now, I don't even do that. Sometimes I will miss an antibiotic course. I know I shouldn't say that, but sometimes you do if you have to take something 3 times a day. Similarly, with the stimulation protocol, you may forget. Now, this individual wasn't always complying with treatment. So we see improvements at the beginning, but then because was getting better, stopped. We can see the scores going back up and down. And again, this just shows that we do need to emphasize all of the other things. It's not just about prescribing, but following on and making sure we look after treatment throughout its course. One of the side effects of antidepressants and SSRIs specifically is also around blunting, emotional blunting. So where you anticipate to get a response, if there's good news, potentially sad news, you don't really feel it as much. You almost feel withdrawn. So this individual, this lady was suffering with that. So she stopped. Now, interestingly, she actually noticed at the beginning her scores went up. You can see that in the first week. And what she described to me was, I'm just getting more emotional. I was a little bit more anxious. But actually, she said, I was starting to feel the world again. So it was actually opening my eyes to what's actually happening. And then we see once that emotion almost starts to return back to what she described as normal, then we see that steady decline in the symptom score again improving as well. I'm going to stop it there. That hopefully gives a very quick, could have been quicker, but a quick overview of what flow is. And I'm sure we've got some questions, and I'll hand it over to Sherry.
Yeah, thank you, Dr. Garcha. Yeah, I think that set the stage really well. I think we understand what it is and a little bit of how it works. So, a couple of things from those slides immediately before I jump into some of the maybe more theoretical questions is on the data that you presented, it looked like there maybe was a difference in gender. Are you seeing it be more effective in male versus female?
No, we had thought that there could be differences. The two things that we considered that may have had, or three things. One was, is there a difference with some types of medications? Are there differences in both gender or ethnicity? And left and right-handedness as well. So that was another thing that's come up with where you're targeting in the brain. Actually, all of our real-world data to date doesn't show any difference in that at all. So we have depression is at least twice as common in females than it is in males. But in terms of our real world users, we have a 50-50 split. So we have more males as a proportion of those who suffer with depression who use flow, but their outcomes are actually equal.
Okay, thank you for that. Yeah, and then I was taking notes as you were speaking here. Let me look at my note about the I think it was male one, that case study that you shared. It was a dramatic improvement. What can you tell us about the time frame? So it looked like the time frame on some of those were over 20 weeks. And is this something that you prescribe and people use it through life, or do they go through periods of using it and intermittent use, maybe?
Sure. So the treatment course, as it says even in the FDA, is usually 10 weeks. We say give it for a period of 10 weeks, and that would be ample time to know if this is going to work. If we start to see improvements, great, and hopefully they can continue and also get even more improvement over time. If by 10 weeks there's been no effect whatsoever, then this is unlikely then to work. We had envisaged, even in other regions, that maybe after a course of treatment, you might use it, say 10 weeks or 3 months or 4 months, and then just stop using. And with some of the hospital systems that we were working with, the anticipation was almost loaning it out to the patient for a period of time and then getting it back. What we've actually found is users don't want to give it back, because even if they get better, the fact is, if they're aware, and this is about empowering users, if you're aware that your mood is starting to get worse, and sadly with depression it can get worse, then it was something that they could start without having to wait. And because of its quick results, before things escalate, before things get more serious and they need to consider medication and other things, this was something that they were able to restart. We've also got many other users who will continue to just use it. They may not follow the full regime. They may not do it 3 times a week. They might do it once a week, twice a week, just to keep things ticking over, in addition to all those other things that are hopefully helping, lifestyle measures and everything else. So 10 weeks would be a course. Most users will use it for longer. Some will get benefit a lot earlier, but I'd say 10 weeks is the minimum somebody should use this for.
Yeah. Okay. Very good. Yeah, and the other that same case study that I was talking about, well, that you mentioned, actually, no, it was a case study where it was a female whose initially got worse, right? Because she was feeling the emotions, those emotions had come back. And then it looked like the system itself was using it for emotional regulation from that standpoint. So outside of depression and use in depression, are you finding that for just overall emotional regulation? And what are some of the other applications that you're using this for outside of the United States?
Yeah, so the indication, the license indication, both in the US and other regions, is for depression. But depression, again, is a very, very broad thing. Within there, there's a lot of individuals who have comorbid anxiety, and actually, anxiety can be a symptom, or one of the symptoms of depression.
Mhm.
Insomnia is a definite other one, which has a lot of association. But depression, again, as I think I was mentioning in the case studies with the individual with ADHD, often doesn't exist in isolation. And so what we're finding is that in our real world data, almost we've covered pretty much everything, I guess, in terms of other comorbidities from diabetes, hypertension, asthma, bipolar, addictive disorders, fibromyalgia, chronic pain, everything we've got examples of because it doesn't really have interactions. And we are looking to say, well, which of these do we want to go and get formal studies done so we can get then approved and licensed indication? But we're seeing good results. And some of those, I recently did a study in menopause symptoms, just as an example. I mean, it's not a diagnosis specifically, but those who had depression but were suffering with menopause and perimenopause symptoms, and seeing dramatic improvements on even things like hot flushes and anxiety symptoms, brain fog. So because of the area it's targeting and the control and regulation that it helps, we're seeing a lot of effects even on other conditions as well.
Can you explain, and that's fantastic news actually to have something for that's non-pharmaceutical. Can you explain the neuroplasticity around how this works just a little bit? I mean, you talked in brief detail about how it's affecting that one area of the brain, but in general, from a depressive standpoint and the improvements that go over time, can you walk us through what the neuroplasticity components are of that?
Yeah, sure. So I think the way I'd probably explain it is almost thinking of a phone in low power mode. It's an analogy I quite like to use, but think of the brain as it's got everything structurally that's there, but it's just not working quite as efficiently. So the neurons, they're not, when I say they're not firing as regularly, that's the phone, yeah, in low power mode, it's a bit more sluggish. The screen, for instance, gets a bit dimmer, right? That's the fog that people might see outside, or the dullness. And things are then also slower as well as a result. You don't have as much energy to do things. Your sleep will be affected, and those are those draining apps as well. So things will load slower and everything else. What this is doing, and that represents what's happening in the brain. So everything's still there, the neurons are still there, but they're just not firing as fast as they would like. So the neuroplasticity here is, well, how can we modulate that? How can we modulate that plasticity? How can we get those neurons firing more regularly and connecting to the areas that they need to? The brain is just that remarkable network. Over 100 trillion synapses, those are the gaps between neurons, over 100 billion neurons themselves. So a fantastic network and connections, but they need to be firing in order to pass the signal on to each other. And then with the modulation aspect is we're influencing that. We're just giving that nudge to the areas where it's needed. So that's like putting the charger in. The charger's there, right? It's providing that extra juice, it's providing the energy, the screen will turn off. But as soon as you remove the charger, then things can go down if you haven't charged enough. So what do you do in the background to change? You need to build that momentum, you need to strengthen the underlying connections. And so it's reinforcing that by not just temporarily not giving one stimulation, not just having that neuron firing a bit more regularly short term, but getting it is a habit to fire more regularly.
So if I think about that, and I do love that analogy that you used, it's also sort of like weight training, if you will, for the neurons. Is that also a good analogy?
Yes, yeah. It's having physiotherapy on something. Like
Yeah.
somebody has a shoulder issue. I could have one session of PT and say, oh, it feels a bit easier. But you need to have that sustained. You would need to go back and you need to carry on those exercises in order to then build the strength up so that the pain doesn't come back. And it's similar like that. It's not, this is, it's giving that initial charge, but it's helping to just build and repeatedly doing it so it can absolutely strengthen and do the weight training.
Oh,
Yeah.
okay. Yeah, I think that's very helpful for me to understand as well. And on Monday we had two individuals talking about increasing the oxygen flow, blood flow, and which also brings oxygen into that area. Is this also enhancing that blood flow through the electrical stimulation component?
Yes, so the earlier research seems to suggest this was simply only on just the firing. It was only stimulating the neurons and then causing them to fire more regularly. But more recently, it's also shown that there is a neurovascular element as well. So even in terms of blood flow, just helping increase blood flow along those levels as well. So it's a combination of both. When I talked around regulation more, even when I was talking about menopause symptoms, it's even saying with some of the hormonal regulation, again, this probably going to again be linked with a bit of blood flow, but there is more that's going on that we're understanding better. There are MRIs, we're doing some functional imaging, we're measuring EEG data as well to understand this more. It's not as simple, basically, as saying apply a little bit of current and just the neurons will fire and things will improve. There's a lot more to unpack.
Yeah, and I wanted to dig into the cognitive behavioral therapy that you're integrating in that. Can you tell us a little bit more about that? I know you said there was an app component to it, but how is it working and how are you integrating it?
This touches on what I've said before. Nothing works in isolation or completely for anything. This is on any condition. I would, if I were to say, just use flow and everything will be better and you don't need to use anything else, frankly, I wouldn't believe myself. That's not the case. This is a tool in an entire toolbox, and it's got to be individualized. So the therapy component, and this is just introductory. It's not licensed CBT. It's not what you would get when
Okay.
people see therapists. It's introductory modules, but it's helping explain, which I think is really important as well, to say there are so many other factors here that we need to also work on. So improving diet and what is good diet as it relates to mood, activity and exercise. How does that influence? What about sleep? What about thinking through if a new trigger comes on? What are some of those techniques that you could use? So it's trying to frame and explain, but also give some nudges and exercises to help with what to do. There's a big feature on meditation, for example. So again, all of those things which actually also influence plasticity, but is giving that as an introduction and saying, here's the product, here's the electrical stimulation, but let's work on all those other things so that this can be hopefully lifelong improvement.
Yeah, that's a fantastic feature to include that because those things do increase the plasticity, the state of the brain, so that what the flow does can be more effective. There we've got quite a bit of questions in the Q&A box, and so I want to turn to those here. I think, can you touch on the rollout for the United States a little bit more and the insurance coverage component?
Sure. We are having conversations with a number of insurers right now. In fact, I've got one later on today and I had one yesterday. So, look, our expectation is we want to launch in the next few months. We've had FDA approval, but we want to launch in a way which is very considered, working with partners and making sure, again, what I talked about earlier about access. Who can get it? Can they get it in the right way, which is managed, not just about prescribing and not having overseen that treatment. So we're looking to do what reimbursement will look like working with payers. We're also saying if that is going to take a bit longer, is there a cash pay component and something as well? So it's coming in the next few months. Unfortunately, I'm not in a position yet to share exactly when. My hope is in the next sort of 3 to 4 months. As soon as we do know, we have a plan and how coverage works, and how you get access to it, we will share that on our website. But we're working very hard to do that as soon as we can.
Yeah, I'm sure there's probably quite a demand given that you've gotten, did you say 60,000 units in uh
Correct.
use? Yeah,
Mm.
so there it's clearly working if you've got that level of demand, and it's just how to roll it out in the United States. So for those of you in the audience, if you're trying to get access to this, go ahead and bring it up now with your physician and have them check into it and make sure they're monitoring it as well if it's something that you're interested in trying and you feel like it's a fit. But you will need to have a prescription for it, it seems like at this point.
Correct. Yes.
Yeah.
For the US, it will only be a prescription device.
Okay. Okay. So there's a question here about what if there is DAI to the right frontal cortex? I'm not sure if I understand what DAI is. Do you know what that is, Dr. Garcha?
So
DAI to the right frontal cortex. Jenny, if you want to drop that in there in your question so we make sure we answer it accurately, let's do that.
what I'll say more broadly is in terms of even if there are structural issues in the brain, like post-stroke,
Hmm.
shunts, and so forth, it's not really an issue. Now, there are the only true contraindications. So the only time that you cannot use flow is if you have metallic skull reconstruction at the site of where the electrodes would sit. So again, if you show this device, so where these electrodes sit, if there's metal there, or you've got broken or very damaged skin there, then you can't use it. But for everything else, even if you have some implants, dentures, pacemakers, there's no issue with it at all. So we have a number of users again in the real world where there's again, post all of these things, post surgery, where they've had shunts in place, many post stroke. Again, sometimes because a lot of these conditions will also then lead to, sadly, but unexpectedly, the mood deteriorating. So people can get depressed as a result of those. So it just is can really help in those circumstances.
Yeah, and then we've got quite a few questions about that with post-stroke or other types of injuries, and it certainly would make sense that this would support that. Um, I'm wondering though if you would be able to get the because of the way the FDA approved that, would you be able to get access to it for that reason? Because is it just for moderate to severe depressive disorder, or is it depression? Will you be able to get a prescription for depression, just mild?
So the indication is for moderate and severe depression.
Okay.
So the decision, as it is for all medicines, is again it's at the discretion of the physician. So
Okay.
if they felt that they wanted to use this in a case of mild, that's they're able to do that. They can prescribe things off label, and many medicines are. I can't advocate it from the perspective of flow. I can't endorse that. But in other regions, as I mentioned, for me, when I'm practicing, I do routinely offer this as a first line option for those at point of diagnosis, be it mild, moderate, severe as well. It doesn't really matter. I always have this in my toolbox, which I share with patients because our data shows that across all it can be helpful. Again, I'll say it doesn't help everybody, but it can be used, and I use it routinely across all.
Good. Okay. Yeah, I think that's helpful to answer some of these questions. We've got time for a few more questions. So I want to go ahead and ask you, if you will, or I'm going to throw up a poll for this particular session while we answer a few more questions. And if you will give us your feedback, that would be much appreciated for those of you in the audience. Um, I was wondering, Dr. Garcha, if you can talk about the future in general for wearable devices in psychology and that layering that you talked about. What is the next 5 years going to look like? Because we see a lot of these devices coming online right now. You can go and buy things off of Amazon that are that people are positioning as to help depression, to help mood regulation, etc. So as we move forward to that area where that seems to be becoming the norm, what do you see taking place? That's part one. And then part two, as I think about those other devices that are out there available, what sort of questions should people be asking about how they work to determine if it's worth the investment at all?
So it's an area which we're seeing so much research happening, which is great. I mean, even from a Flow's perspective, we've got in our R&D team, we're working on new devices. So one of the features is important, I think, to touch on is around the neurofeedback. At the moment, there is nothing that the device is not responding to any signals for that individual. It doesn't change the treatment intensity, it doesn't change the time, it is just a half an hour, 2 milliamp session. Works incredibly well, as the data suggests. But what if we took that and said, are there any signals which would suggest or show that we need to maybe reduce the amount of current? Or we could say you need to use it this many times a week. I think there's already research happening, and we're doing some of that as well to understand that. And as well as that, just saying, well, broader, what other conditions? We've gone for depression. Most of the evidence was around there, but evidence is improving and increasing on many others. We've mentioned already in this talk about neurodivergence, I've talked about pain, I've talked about insomnia, even depression. What about adolescents? There's a massive issue in teenage and adolescent mood issues, mental health issues. Services for children, sadly, are really not good enough, frankly, just to call it like it is. But also, what about antenatal and perinatal treatment options for those going through that time? Again, very limited. So expanding in those population groups, even within there, and looking more. We've got some encouraging information and research around addiction. And we know with a mental addiction, not just to drugs, but smoking and alcohol and even painkillers and other things as well, just looking at that and saying, again, because we're focusing on the DLPFC, I think there's a lot of opportunity to expand in there. And to your point, look, there are many devices. I think there's a lot of credibility. I'm not just saying this because Flow is FDA approved, but you do want to look for the evidence. You want to say, look, has this gone through enough of the due diligence? Is there enough scrutiny? Has the regulators, have others looked and seen what the evidence is like, both from a safety and efficacy perspective? Because it's easier to release something with some anecdotal evidence than it is to go through the regulator. There's a reason why we went through and worked over 3.5 years to get FDA approval. We still feel it's absolutely the right thing to do, similarly we've done with every other market. There are devices, there are medications, there are supplements that don't go through that level of rigor. That's not to say the only things. You must have evidence to prove something works, but going through that, I think, is something very helpful, and discussing it then with both physicians and academics to understand as well.
Very good. Thank you, Dr. Garcha. And I guess, as a key takeaway for me, and it's just reiterating basically what you said, is this device would be perfect for layering with other devices as an adjunct. It can be used individually on its own, but if you're considering going down the path and you've got major depressive disorder, it's something to look as another tool to put into your toolbox. And that's how probably we should consider this as our first step out of the gate with it.
Exactly. Again, just individualize this. This is something that can be used. I've got so many patients who use this as a standalone device with nothing else, and it works remarkably well. I've got people who are on a couple of medications, 3 medications, just for their depression. They've been under inpatient care and things as well. They're also using this. Some of them who are using, and this is helping them come off their medication because they were unable to come off by themselves before. So I think there's a lot of opportunity to say this can work because of its safety features. Let's see about how it can work across that spectrum, meeting the individual where they are with their current health and saying how it can be tailored to them.
Perfect. Okay, well, I think that's the great final way to end this conversation. So thank you for that summary there. And thank you for joining us. And we will look for this on the rollout in the coming months.
Thank you so much.
Bye-bye. Thank you, Dr. Garcha.
Bye bye.
That's very interesting device. I think that's going to be because it's in home. I believe that the usefulness for that is going to be widespread. And also because it's home at home. I didn't ask about that research, but it does make me wonder that if it is so much more effective because it's at home and people are calm and in their space and they can do that when they're trying to get quiet time or meditative time. So I see a lot of potential for that. So I'm so thankful he was able to share that and give us a heads up on when it's going to come down the pike for us and be available.